Welcome, everybody. Thanks for joining us today. I'm Katie Hathaway. I'm Microdevelopment Manager here at Qbtech, and I work mostly with our virtual care providers. And I'm joined today by Charlotte Coates, who's a psychiatric mental health nurse practitioner and the founding clinical lead at Legion Health, which is a virtual care provider here in Texas, and Danielle Vaeth, who is Qbtech's head of strategic market development, who also leads the work that we do with virtual care providers. So we're really thankful that you're here joining us today and excited to kick off this conversation that's giving between two ferns. Maybe not as funny, but we'll have a great time here today. So we'll just get started. And Charlotte, I'd love to know what inspired you all to adapt a fully telehealth care pathway versus a more traditional care model at Legion Health.
Well, thanks for having me first, Katie. It's a great question, but just a controversial take. I don't actually think the virtual care pathway for ADHD is that radically different from a really good evidence-based outpatient psychiatry care pathway. And that's kind of the point, is that it shouldn't be so drastically different that we are sacrificing quality of care. If anything, we're just adding quality of care by increasing accessibility. And what we noticed was so many patients have a really tough time accessing affordable, high quality mental health care, period. And then when you add on ADHD concerns, where it's a stigmatized population, where there's a lot of additional barriers to seeking care, they have an even harder time accessing care. So it's a no-brainer for us to incorporate virtual ADHD testing and care into our pathway.
Yeah, how have you seen it's impacted your patient's experience in being able to be more consistent with visits or able to be seen quicker? How have you seen it impact their care journey?
We have a whole subset of patients that probably would not be able to access ADHD treatment if they didn't have access to virtual care. And a lot of those patients come from rural areas, they have transportation barriers. But I think another trend that we see is that patients that have previous diagnoses of ADHD or patients that have concern for ADHD, maybe they have a really good rapport with their primary care physician, and the primary care physician is actually saying, I think you have ADHD. I don't have all the tools right here and the expertise and the time to diagnose you and then implement a treatment plan for you, but I really think you need care. And that's a population that we've been able to help a lot.
Yeah, that's great.
Yeah.
Great. Danielle, what would you say with the work that you've done at Qbtech with virtual care models versus traditional, and why folks are adapting them?
The core, I think, is improving accessibility, and giving patients a choice and clinicians a choice. I think those are the ties that bind a lot of the clinicians that I've spoken with over the years, and why they've continued. They might have adopted it for different reasons out of necessity, but the continuation has been the acceptability and the ability to really personalize in a different way the way in which care is delivered and the way that patients experience care between the clinician and the provider. There's a need for in-office visits for certain patients and for certain providers, depending on what's needed and what's being discussed. But there's also an unlocking, I've heard, that occurs within that patient-provider dynamic in a virtual environment. And patients are showing up more regularly to their visits and more consistently. Maybe they're from their car sometimes, but they're showing up to appointments and not having to, even from a burden perspective, leave the office or put their kids in daycare or extend different things. They're able to maximize the opportunities, and because they see those benefits, they show up more.
For legal reasons, when we see patients in their car, the car is stationary, not moving. Yeah. Just so you know.
Okay, good to know.
For legal and
Check.
Best practices.
They are not.
Good clarification.
They are not driving.
Good clarification. Yeah. Good clarification.
Yeah, I love that concept of access and the ability to, I know that I've worked with so many parents in my career, and understanding how difficult it is for them to be able to get their children to appointments and then even have appointments themselves, to be able to do that from the comfort of their home and get the care that they need is so important. So being able to open that access. When it comes to more rural populations or underserved populations, y'all practice in Texas, huge state, big reach. What are some of the challenges when it comes to those groups that you have experienced in your journey?
So aside from the patient's subjective experience of those challenges, which we hear them talk about it all the time, just the nearest ADHD provider to me is 6 miles away, or, I mean, that would be reasonable, but the ADHD provider is 50 miles away. When you look at a clinician's schedule, if a clinician is available from 9 to 5 or 9 to 6 or 10 to 6, there's only 1 hour there that's occurring after work hours. I don't even know what we did before the virtual care model. How are we fitting patients but into convenient time slots for them? Kids were missing whole days of school to go to an ADHD provider to get, medically necessary treatment. They're missing school so that they can do better in school. It doesn't make any sense. Now, patients can take an appointment on their lunch break. They can carve out time for themselves in the morning. And so we're also just optimizing that provider's time. We're expanding that provider's reach and their ability to treat more patients.
I would add on that to the patient choice when it comes to providers. There's a transparency that's really happening around being able to look at someone's bio, look at their background. Do they look like me? That is important, right? When it comes to affirming care and delivery of care and the patient choice. So I think it's not just about can you get to the nearest ADHD provider is 60 miles away. It's also I'm opening up a different dynamic when it comes to the patient or the providers I get to have access to. I'm in a rural part of Western North Carolina, and my primary care doc is no longer practicing, and we just went to get onboarded with a new clinician in our area for primary care, just well visit, and it's the end of January, and I was told the end of April is the first appointment. And so
Wow.
The shortages are real,
Yeah.
right? And I think this is something, and that's in primary care, not even in behavioral health. So I don't want to make this magical assumption that, you can find a provider that looks like you and can treat you the way that you need to, but there are options. It does unlock options. So